Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Beclomethasone. Its brand name is Qvar. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, I've put together some slides to go over the information associated with this medication, so let's jump right into it. So the first thing to discuss here will be the mechanism of action, or how this medication works. So beclomethasone dipropionate is a prodrug which is converted into the active metabolite beclomethasone 17 monopropionate. It is a corticosteroid that exerts its anti-inflammatory effect by inhibiting both inflammatory cells and release of inflammatory mediators. In terms of indications or reasons we would prescribe this medication to a patient, well, beclomethasone may be prescribed for asthma, as well as rhinitis, whether it be allergic or non-allergic. And finally, this medication can be prescribed for polyps of the nasal cavity and or sinus. With respect to contraindications or reasons we would not be able to prescribe beclomethasone, well, first off, we wouldn't give this medication to a patient who had a hypersensitivity to beclomethasone or to any other component of the formulation. Also, we wouldn't use this medication for primary treatment of status asthmaticus. Now for some examples of dosing with beclomethasone. So in the treatment of asthma, using the brand name Qvar, if a patient is not currently on an inhaled corticosteroid, we may see an initial dose of 40 to 80 micrograms given oral inhalation twice daily, about 12 hours apart if possible. We may increase the dose for inadequate response after 2 weeks, and the maximum dose would be 320 micrograms twice daily. For the treatment of polyps in the nasal cavity, using nasal inhalation, we may see 1 or 2 inhalations, being 42 micrograms per inhalation, in each nostril twice daily. The usual dose is 168 to 336 micrograms per day. As with all medications, there are some side effects or adverse reactions that patients may experience while using beclomethasone. We'll go over some of those here now. The only real common side effect with this medication would be a headache, coming in somewhere between 5% and 25%. And some more serious side effects may include type 2 diabetes, immunosuppression, or bronchospasm. Alright everybody, that's all we're going to talk about today with beclomethasone or Qvar. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.